Now for more on the spike in cases and the latest studies on the importance of wearing masks, we are joined by CBS News medical contributor Dr. David Agus. David, let's start with the spike in cases. In reopening, people expected to see the numbers go up. So how much of this is what we expected and how much of this should we be very concerned about?
You know, the number of cases is under our control. As we open the doors and let people out, you can either wear a mask and social distance and practice behavior that we know stops spread of the virus, or you can go back to the way the normal was before the virus. And many people have gone back to the way the normal was. They come home and they can spread the virus. And obviously that gets worrisome when we're tracking at about 1,000 deaths a day presently in the United States.
You mentioned the masks, and there's a recent study out of England. There's a quote, a key message that people can take away. My mask protects you, your mask protects me. You've seen this study. What can you tell us of the importance in it?
You know, it's real. I mean, the data are that if you wear a cloth mask, you block droplets coming out of your face, and it blocks those droplets from spreading virus to others, period. And so we need to normalize that behavior. In Japan, where they wore masks when they were sick to stop spread to others before this virus, they're now all wearing masks and they have very little spread of the virus. This behavior here, though, isn't normal. And people are saying, it's my right not to wear a mask. We all have to stand up for each other as a community, and if we wear masks, we will stop spread of the virus. This study in England definitively showed that it will decrease significantly transmission of the virus.
It's sort of pick or choose. If you'd like to have things opening up, this is one way at least that you can try to prevent some of the spread. Asymptomatic spread has obviously been a concern throughout. And then we heard from the World Health Organization some troubling news, I guess, earlier this week. One report was that it was very rare that there was asymptomatic spread. They walked that back. Can you give us the basics where we stand when it comes to asymptomatic spread?
Yeah, how dare the World Health Organization, spread information that just isn't correct? They were talking about a very small study in China that showed that there was not significant asymptomatic spread in that particular community. But across the globe, there have been many studies now showing that when you're asymptomatic, there are several days you can spread the virus to others, and what we call pre-symptomatic spread. That is days before you're symptomatic from the virus, you are contagious and can spread the virus to others. So this is unfortunately one of the dastardly ways this virus can get out there. As you think you're well and you go out and you could spread the virus to grandma or grandpa and cause significant problems.
Asymptomatic spread is real. That is the message. Asymptomatic spread is real. A lot of people hoping for a vaccine, and there's been so much talk about where we stand in these various trials. They're narrowing the field down a little bit, it looks like right now. What can you tell us?
Well, Dana, this is the positive news, is that there are 130 efforts of vaccines across the globe. They're choosing 5, and in those 5, they're starting production now so that the vaccine is ready in large amounts if the drug works. And so the hope is that these vaccines now, which are entering the late stages of phase 2 study, they went in, they showed safety, now they're showing immune responses, and then we're going to do definitive studies, vaccine versus no vaccine, and show it stops spread of the virus. If they work, they will be here in the fall. And so Operation Warp Speed has started production on these 5 vaccines to get them ready in case.
That would be welcome news, I know, for so many people out there. Dr. David Agus, thank you.